My highlight so far is the session that we had on the EU cancer mission. You know, ECCO has a fantastic role to play representing our 27 member societies and 150 healthcare professionals, as well as having patients at the centre of our organisation. And the session that we had on the EU cancer mission was lively. It had someone from the EU Commission, it had an MEP, and it had other members of the ECCO family. It was a very good session, and the motion that was carried at the end gave the EU a very strong message.
The ECCO 2019 Cancer Summit is a superb meeting as it allows the different stakeholders to exchange ideas during sessions that look at some of the hottest topics that we have nowadays. As the Health Commissioner, Andrew Tykers, just said, there was yesterday a major meeting between WHO, the European Commission and others about vaccination, and at the same time we were discussing that in the setting of cancer. We have had discussions about this buzzword artificial intelligence, which needs a better definition. And with all of this and other sessions, we hope that we will bring some movement into improving cancer care for all our cancer patients in Europe, and also not forget prevention and then survivorship care.
We had a summit in 2018 and it was pretty good, I have to say, but there was still a flavour of a conference about it. In 2019, we've got it nailed. It is a true summit. We've sent out all the resolutions, we've said to people, please check this with your organisations. If you don't like the wording, tell us and we'll change the wording. And we've got those recommendations now being voted for by a huge number of people and organisations, experts, if you like, in their own area, patient advocates, healthcare professionals, policy makers, all voting on critical motions that we can now take forward as recommendations into better healthcare.
That is a very, very important commitment to be all together, to involve patient perspective, provider perspectives, clinician perspective, because only if we will have a global vision and a common language, we will cure more patients, we will avoid more tumors, and we will provide better quality of life for our community.
I think we all know that it's very difficult to get research data, outcome data that have been proven in clinical trials into real life. We have been hearing about access problems to new interventions, also about inequity across Europe. And I think that therefore we do not only have to focus on research, clinical research as such, but we also have to focus much more on education, for example, so bringing the research data to the professionals, but also on policy making. And the latter is actually what ECCO is doing a lot, working on policy making, developing their statements that they take to the European Commission. And I think this is a very important work, because by doing this in a multi-stakeholder perspective, I think we can really drive the way to getting the best treatment strategies to the patients, and also the better prevention strategies for cancer, not only at the level of the countries, but also moving it up to the European level in order to, well, address the access problems and address the inequity problems. So I think that's a very important message from the conference.
Well, like I said, I am so looking forward to a lot of the work being done within the European Commission and the European Health Commission on cancer care and cancer quality. And I've just been very, very, astounded, I think, by the level of thought and by the level of seriousness of sort of everybody here involved. So it's been a wonderful thing for me coming from the United States to see the work being done here. And again, what we can learn, which is, the major reason why I'm here is what we can learn from what the European Union is doing in cancer care that we can bring back to the United States to care for our patients.
ECCO is a federation of professionals, a federation of patients, nurses, and the message is the fight against inequality and the right application of the cross-border directive of the UE Parliament, who allows you to go everywhere you want to be cared, but nowadays is not that good, fairly applied. So my hope for this summit that the message that will born from here will be strong and effective to our politicians.
This is very nice actually, because it has been since 2017 we have been together and we are trying to get know each other, the specialists and generalists, let's say, as physicians, of course. So I'm now pretty sure that in 2019 at the end we are in a common ground. So this is very enjoying to listen to all people talking, all specialists and experts talking about the importance of the primary healthcare services and the implementation of it for the cancer care. I think that will be a very good sign in 2019 that we are on the same ground now. So that is very enjoying.
Well, it has to be the discussions around HPV. I think the meeting the session where HPV was discussed was incredibly useful. And what was so positive was that 98% of people at the meeting voted in support of the resolutions to take forward work on HPV, and I find that hugely encouraging.
Well, I think there's a lot of enthusiasm about AI. It is clear that AI will play a role in the cancer care. I think we are living in very exciting times. We have to think that the technology is largely already there it has to be transferred to real patient care. And there are many open questions that we do need to address, like legal questions, ethical questions, social questions, before we can implement AI in a clinic-wide scale. But this is now the time to think about those questions.
There's a lot of great stuff going on at the ECCO conference this year, and I think it's really one of the only conferences where we have all stakeholders represented that are part of cancer, from the politicians, commission, the nurses, the patients, the clinicians, all the different disciplines in oncology. And I think that's pretty unique. And what I really like about the conference is that we not only discuss things and do death by PowerPoint, but we have interactive debates. We have votes on motions, which we have discussed with the members before. And we have a very strong patient input. So the patient advisory committee is integrated in all sessions. We have co-chairs, we have speakers. And I think it's pretty unique. And I think we're going to come out with actionable things with the resolutions that we have at the ECCO conference, which actually is not another blah blah conference, but it's something where we can really follow up on actions and also put pressure on people that don't want to change, because we need change in cancer.